Good morning, good evening, good night, wherever you are, family caregivers, agers and thrivers. Welcome back to Lana's Little Things with me, Dr. Lana, specialist gerontologist. The channel where we talk on all things on living agelessly, bridging generational gaps, family caregiving, the joys and the sorrows, to be honest, entrepreneurship, life itself. And then we come up with some special days and some special months. And this is the month of November, special for diabetes awareness, men's health month, as well as family caregivers month. So we have a packed schedule, and we had already started it off with talking a lot about men's health, prostate health specifically, and general health from Mr. Lewis, eminent surgeon. And we will continue today with Mr. Lashley, who is no stranger to us because he joined us last year for Men's Health. So he's a well-known pharmacist, and I'm going to give a brief what I know of Mr. Lashley, and he's going to join us right here. So good morning, Mr. Lashley. I'm just going to introduce you for a little bit. Mr. Lashley is a well-known pharmacist for, let's say, more than 30 years. Although he looks like 30 himself, I know. But he knows he's what I have loved in the years that I've known him is that Mr. Lashley not only is knowledgeable, but he also has this acute understanding of the complexities of medication combinations and who should use what. And even if they come from people go, to triple, 4 and 5 different doctors and then come back with more medication, Mr. Lashley somehow able to call everyone, tease it out, explain everything, and still come to a happy conclusion. And because he's able to explain things so well to his patients, to his clients, they are very appreciative, and he is like the patriarch of the village, so to speak. So in addition to that, he manages his own pharmacy right here in Barbados, which would you believe is round hay. Now that's a Bajan expression for around the corner, but it's actually round hay, a piece of hay. So either way, I like it. Mr. Lashley is very pleasant. He has a lot to tell us now today. You gents, please listen out. Yes, we're going to continue some general health, prostate health, but Mr. Lashley has something special for you guys, and you know what it is, that area which everyone needs to fix, and that's the down low. So go ahead, Mr. Lashley, welcome.
Well, good morning. I didn't know all of that about myself, but thank you very much for that. Yes. Just want to plug a little bit for the pharmacy. I mean, we operate in the One Accord Plaza. It's called Round Hay Pharmacy. We're open from 8:30 to 5:30 in the morning, in the evening, Monday to Friday. Saturdays we're there from 9 until 4. And then on Sundays we actually open from 9 until 2. Now, the pharmacy is located in the area where it's kind of a community pharmacy. Lots of people come from different parts of the diaspora. We get patients from all the way in Christchurch at times. We get people from the rural parishes. And so quite a big mix of customers come through our pharmacy on a daily basis. And Dr. Lana, you know that the services which we offer, we do blood sugar checks, blood pressure checks, we do cholesterol checks, and we have a counseling area where we actually counsel our patients and talk to them, especially men, and saying that this is what we consider to be men's health. We really need to narrow in on some of the things and the intricacies of things that men are concerned with. And I'm not, sometimes I know that you are in your area of gerontology, and so we're talking about the older people and so on. But I've found over the years that there are lots of men who are young men who don't take care of themselves properly. They don't go to the doctor. They think that it's macho not to go to the doctor because they're strong, they're big men, and all of that. And so we're realizing that after they don't go to the doctor in their younger years, they end up in your office around 50 or so, probably even in their 40s, with the non-communicable diseases, which we will discuss this morning. And we also are going to look at areas of, I call sexual health. And one of them is erectile dysfunction. And this is a topic, Dr. Lana, that captures a lot of men's attention. And not only young men between the ages of 20 to 25 are having problems with, as we know, the old saying, rare agents, keeping it up
Yeah.
because of areas that they don't know themselves, because they don't know their blood sugar levels, they don't know their blood pressure levels, they don't know their cholesterol levels, and so therefore they're at a loss as to why this particular situation is happening to them. And I
Wow.
want to really narrow in on it this morning because I think it's important that men take care of their bodies. I'm even talking simple things like creaming your skin. A man does not think that creaming his skin is that important. And they end up in the dermatologist office with some crazy skin conditions, as you may yourself may even encounter some of them. I have a guy who works with chemicals, and when I first met him, he wasn't aware that he had to wear long sleeve and cover his face and so on.
Wow.
And Dr. Lana, the entire epidermal layer was covered with this scaly like layer. And when I got close to him, it was hard and I mean really, 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 really untreatable. I ended up having to send him to the dermatologist, and it's been years no, and it still hasn't come back to normal as yet because the chemicals that he uses, he sprays and he does commercial work, but all the chemicals end up on his skin. So that is just to introduce the areas where men need to take care of. But more so importantly, this thing called erectile dysfunction. And it simply means that the inability for a man to have an erection either prior to having intercourse or during intercourse, where the there's the it gets it is not maintained during the sexual encounter. Now, this has a lot of psychological problems for patients and for men because when a man is having this problem, his psychological being becomes very, very, very challenged. He thinks less of himself. He doesn't want to talk about it, and men generally don't like to talk about their health.
No, no. That's usually not to stick a pin after if they manage to get to the doctor, after they get to the doctor, it's usually by the way, the last thing before they leave because they could mustered up the courage then to tell me about it or to say, well, this medication is actually not it's giving me some problems. And like
Yes,
that was probably what they came for first. But because it's not talked about, it doesn't get talked about and it doesn't get addressed. And I just wanted to add, there's Mr. Lewis had also mentioned that it's sometimes it's because, and you can verify this, it's because they're having erectile dysfunction, which is a vascular problem, blood vessel problem, maybe Asian, but as you said, 20, so it may not always be an Asian problem. It's a blood vessel problem. And it is connected very often with heart disease. High, as you said, high cholesterol, all those non-communicables. So if blood can't flow to the heart, it certainly can't flow lower down. And so that they think it's this problem only, and then realize, oh, my pressure's that high, my sugar's that high, as you said, my cholesterol is that high. So one can say it's the problem that might bring them, but it then opens a whole set of um, concerns that a physician might see. So I am please continue. I just wanted to stick a pin in that because then instead of focusing only for men, instead of just saying, "Oh, he's just talking about this one small part." We can, I let me hear how I can fix that. No, Janice, this is going all over your body. So,
Yes, because you know you go to the doctor and the doctor prescribes something for your hypertension. You may be a young man
mhm,
where there may be some hereditary factor, or you may just have it in your family,
mhm.
and because of the concern of the doctor wants to treat you and not just put you on exercise and diet because you're having other concomitant illnesses along with it, and he wants to have that looked at carefully. So he gives you medication like, let's go with the beta blockers. And when I say beta blockers, I know I have to explain what I mean by beta blockers. But we're talking about drugs like atenolol, metoprolol, those types of drugs that are used to treat hypertension. Now, when you're talking about this when the doctor prescribes that, one of the areas these drugs tend to cause a problem with erectile dysfunction. And so therefore, you go along not knowing this, and you realize that this thing is happening to you. But because of your ego, you are not wanting to discuss it with your doctor. And because there are other drugs, as you know, Dr. Lana, there are other drugs that the doctor can choose that would not necessarily cause some problems like that. So we have problems with patients who are diuretics, meaning especially the hydrothiazide diuretics, like hydrochlorothiazide. That's a drug that is in combination of many hypertensive drugs,
Yeah.
and so you think you're getting away from it, but even though it might be at a low dosage, it still can have that effect of causing the dysfunction of the erectile tissues. And so we don't want to get too technical because we're having lay persons who are listening to us. So therefore, I need to make sure that I'm clear when I say to you, when you go to your doctor and you're hypertensive, you're diabetic, you're even asthmatic, you have heart conditions, you have psychological conditions, because some of the drugs that we treat for depression and anxiety and those kinds of things, Dr. Lana, also cause erectile dysfunction. And you're talking about your fluoxetines and those kinds of drugs that persons are using, your lorazepams, for instance. All those drugs are drugs that can cause it. Of course, dosage, as you know, you write the right dosage and you give it for a period of time. Sometimes these drugs, because of the nature of them, can get very addictive. And so therefore you may have a chronic patient who has to take these medications on a regular basis. And we're talking about men here, but of course, women do have problems with sexual um, problems also. So we have to make sure that we are clear. And so I wanted to make a point about the drugs, especially the over the counter drugs, the drugs like the enhancers that we sell at the pharmacy, or that are easily used by patients. And I in my pharmacy for sure, if a gentleman comes and he wants to have a sexual enhancer, I usually, excuse me, I usually ask him what type of medication he's on. What are you using? Are you hypertensive? Are you diabetic? And then, based on my experience, I can then make sure that you're using something that does not cause any problems for you. But I want to say something too. There's lots of pressure and lots of as I mentioned just now, psychological problems. And I mentioned this a while ago on another show where I said that relationships are are sometimes are being threatened by the fact that a man is having this problem,
Mhm.
and the female does not understand And so she makes demands on him.
Or
So he goes
comments.
out there, comments.
Mm-hmm.
So he goes out there looking for something to solve his problem.
Yeah.
So they end up at the pharmacy with the pharmacist, not knowing that they are hypertensive, not knowing that they're diabetic. I had a patient who came in, I did his blood pressure, and he complained of tiredness, he complained of blurry vision, a number of symptoms that I thought merited me taking his blood pressure. When
Wow.
I took his blood pressure was extremely high. So, and he was not aware of it because, as you know, these diseases, non-communicable
Oh.
diseases, are slow, slow killers. We call them slow killers.
Mm-hmm.
We don't necessarily know until we check
Yes.
or until we have a crisis.
Yes.
So what I'm saying to you, of course I had to deal with him and I had to get him to the doctor and so on. But imagine you come to the doctor. Sorry, you have this condition, but you don't know. And you come into the pharmacy and you buy, or you go into a pharmacy and you buy a male enhancer. And you go home, you take it. And I actually had a story where a patient collapsed, a gentleman collapsed because he was taking other hypertensive medications and he took one of the enhancers that are sold in the pharmacy. So, and he actually had to be revived in the hospital and so on. He didn't die, but he had to be revived in the hospital. All I'm saying is that the awareness must be that drugs that are the enhancers, they're good. Some of them work well, they're herbals, etc. But they have ingredients that can cause some serious problems, especially for patients who suffer from non-communicable diseases.
Wow.
And and the other thing too, even though the doctor can prescribe, of course, I know that they're the peptidase inhibitors, but I don't want to use that long term. It's simply the drugs like Viagra and Cialis, sildenafils, those kinds of drugs also to have some serious side effects. But the doctor is the best person to guide you as a man to what dose, what when you should be taking it, and of course the pharmacist then follows on by making sure that there are no other drugs, especially sometimes over the counter drugs, vitamins, Dr. Lana, vitamins, even cough mixtures,
Yes.
right? That we have that has some very serious ingredients that can cause increased heart rate, it can cause palpitations, and these things are not just we're just calling these words. These are serious things that can cause death. And
Okay.
so, even though there are the traditional drugs that are used to treat erectile dysfunction, there are other areas, other things. Now, you mentioned that you had a gentleman on who spoke about general health, and exercise is important. Changing one's diet is important. Now, you have certain types of exercises. I've just been researching something called the Kegel exercises for men who are having erectile dysfunction. So
Okay.
these are things that are outside of normal drugs that you can actually take to improve that area of a man's life. Because let me tell you, that is a serious thing and
Yeah.
serious ego. You
Yeah.
cannot a man who's having this problem and has a wife for say must have an understanding wife, and then they must be able to discuss it.
Yeah.
So we're talking about the social aspect of it now. The social aspect where you're interacting with your partner. This is your partner. It's not some a stranger, but you're having a problem, and you speak to your doctor or you speak to your pharmacist because pharmacists do have quite a bit of information that they can share with you because it's out there. The sexual enhancers are out there, the creams, the gels, whatever you want to call them. But at the end of the day, our responsibility as pharmacists to men is to make sure that we give them the information that is necessary. And women come in and ask also. And I would bring them into my counseling area and I would tell them and I would talk to them about what can and what cannot happen. And we have uh you talk about circulation
Mm-hmm.
and we talk about the fact that these drugs this condition is vascular.
Yeah.
It is a very serious thing for a man and his ego to have that situation. Now, I wanted to mention one thing here in terms of interactions with drugs. Interaction with drugs that are used to treat um, ED, or we call it ED, we call it
Mm-hmm.
elect, just for short.
Mm-hmm.
And there's something called nitrates.
Mm-hmm.
And nitrates, we're talking about I'll just give a simple example. Nitroglycerin, that drug that is used for, you know, what we call, trying to remember the
Oh,
condition,
heart disease,
heart
angina.
disease, angina. Right.
Angina,
Thank you. Thank you,
which is,
doctor. Right.
chest pain that is temporary. You use this medication and it puts back the blood flow to the heart because it's temporarily cut off. It's the
Yeah.
received
Thank you
heart
for that.
attack.
Right.
Right. Mm-hmm.
Yes, of course. And so you're on nitrates and you're on this particular drug, for instance, but you're having a problem with erectile dysfunction. And you don't tell your doctor that you're on this particular drug, or you don't tell your pharmacist. And you end up using something like even your sildenafils or your Cialis and so on. And that is detrimental. That is so bad that can actually kill you without even looking around.
Wow.
It can happen. It can
Yeah.
happen so sudden. We call it one of those sudden interactions that can kill a patient, not knowing that they're on this drug and taking even sildenafils and those kinds of drugs. So that's important. If you have a heart condition,
Mm-hmm.
that you speak to your doctor.
Mm-hmm.
Be guided by your doctor. Watch the medications you're taking. Make sure that you're getting adequate exercise. You're watching your diet. But you must have a good discussion with your doctor, despite how tough it may seem. But you must have a discussion with your doctor when it comes to erectile dysfunction.
I want that is fantastic, and that it you put it all together very cohesively. Thanks, and I think persons are starting to understand the relation between, oh, you're not just taking this. Our body is an island, so whatever you take is going to be working, and whatever you take again is going to interact with the system differently, and so that is something to understand. And also, thank you for making a note. This puts a plug, my passion about us all working as a team. And so this gentleman ended up at your door first.
Yep.
And then you recognize he had high blood pressure. Now he might
Yes.
never have come to the doctor, and he probably only went because you're a male pharmacist. So he was
Yes.
more comfortable with that.
That
So
is true.
I put a plug in for our increased our teamwork as physicians, as in all the health sectors, but specifically pharmacists and doctors and nurses. Doctors who prescribe, nurses who might have a look, and pharmacists who knows like a little bit more of the story. Bear in mind that we are all working together. So if he didn't go to you, you would have been able to send him to the doctor. He might have been one of those casualties. Um,
Exactly.
if they come to me and they go to you and I don't know they're on 4 and 5 other things, but then you can come back and feedback to me, and then I'm like, I had no idea. And persons don't think about these things. So tell your pharmacist everything. I always say, tell your doctor everything, and somewhere in the middle, we will meet to make you as healthy as possible.
Yeah, and that itself, as you said just now, makes the job easier for all of us.
For
If
all.
we have better communication between the pharmacist and the doctor. And it's important because the things that they tell the pharmacist, some things they don't tell the doctor.
Oh, for
And
sure.
I guess it happens where the time that you have to sit down to hear everything is kind of like impossible when you have 6 and 7 patients outside your waiting room waiting to be seen. But at the end of the day, if we have better communication between pharmacists and doctors, then we don't have that issue. You can pick
Yeah.
up the phone. Of course, you know that you can pick up the phone and you can call me and you
All
can
the
say,
time.
Everton, I have a patient here. What is your opinion? And that's how it's all about, because you may not necessarily know all the rudiments of the pharmacology of these medications.
I
You may
don't.
not necessarily know all of it, and that's where the pharmacist comes in. And I always say to pharmacists and even students that I have at my pharmacy, you are the goddess of medications. You need to know what you're doing. So you need to know that when the doctor calls you or you pick up the phone and call the doctor, you can speak clearly and give the doctor the insight to actually help treat this patient. This one, I know we're getting along with time, Dr. Lana, but one last thing. I mentioned this to you, and we talked about polypharmacy a long time
Mhm.
ago.
Yes, we did. It
And
still happens.
this whole thing about ED
Mm-hmm.
and drugs used for the non-communicable diseases, it all ties in, because you have patients who are treating for heart conditions, they're treated for cholesterol, they're being treated for hypertension, and they may have a psychological problem,
Diabetes
or they may be asthmatic.
and
So
diabetic.
you have a whole range and diabetic. So you have a whole range of conditions where multiple drugs can be used. So it's always good to know what you are taking, because you can't hide it from the doctor. Let the doctor know what were your medication. If you think that you can't remember, take it to the doctor. The doctor, these are the things that I have. These are the
Mm-hmm.
things I am on. And if the doctor can see that the medication that you're taking, then it helps the doctor to better treat you as a man than to just continue on the merry way, thinking that, well, I'm a man, I could go and drink 2 drinks and I'm fine. And that's another thing, combination of alcohol in men with these conditions, then having problems with erectile dysfunction. And believe it or not, there's a myth, not necessarily a myth, but there's this thing that men have, or men believe, that if they drink 2 brandies or if they drink two drinks, and they can go down and they can mash up and lick down, and as they say.
Mm-hmm.
But at the end of the day, there's what we call damage of blood vessels. Damage of blood vessels, damage of nerve endings. These things are constantly taking place every single day, and you don't know that. And
Exactly.
so erectile dysfunction is also that area where if you don't have that blood flow, the blood flow got to be coming from somewhere. It's coming from your heart. It's
Yeah.
coming, it's being pumped through blood vessels, your veins, your arteries, your capillaries. So all these things are being transferred through your body, as you said, from your brain, from your heart, through your brain. We call it double circulation,
Mm-hmm.
all over your body, down to your feet, and to the area where you think that you need to have your blood flow to have a strong erection to make sure that you can enhance your sexual behavior.
And your
My
manhood, so
words,
to speak.
your manhood, exactly. And this is serious.
It
I
is.
I will share with you that I had a men's group at a church who invited me to talk about the same very area.
Mm-hmm.
A church group, Christian group. It was a fascinating discussion, because these are Christian men who have this forum, and they just wanted to know. And we sat there, we went over time. We spent so much time talking about it, Dr. Lana.
I can imagine.
So it's something that is always there. I'm always around. I mean, if anyone wants to have a discussion on that, they can call me at the pharmacy. And just one little plug. Our numbers are 537-7863. And we have an after hour number of 266-6587. And these are the areas that we want to talk about. Let's talk to you, man. Let's talk about these things. Let's talk about the fact that you are taking so many different types of medications. But you know what? We can kind of like taper it so that you don't take this with this. You take this at the particular hour. You spread it out. You
Right.
can still take your vitamins to enhance your body. But we as the pharmacists going to tell you, oh, don't take it with that. Don't take it with that because we know what you're taking. But if we don't know what you're taking, and we give you something like, say, maybe ginseng or something like that can cause problems,
Mhm.
then we're in problems.
Wow. Well, imagine all of that. So thank you so much again, Mr. Lashley. That was a mouthful. I urge young and older to seek help from the pharmacist, the doctor, whomever. From my heart to yours, Dr. Nana, thank you so much, Mr. Lashley, as always. And the area code is 246, by the way. We in Barbados. So have a wonderful day and take care of yourself and take care of
Thank
your
you.
health.
Take care of your health. Thank you.
Bye
Right
bye.
there.